topic that I'll be discussing is Lewy body dementia. And so for those of you who have been tuning in regularly, you'll know that last month I did an overview of Alzheimer's disease, and our last Facebook Live broadcast I did an overview of vascular dementia. So I was asked to talk about some different types of dementia. Today I will be talking about that overview of Lewy body dementia. So, you know, when you're thinking about just bringing us back to that term dementia, dementia is an umbrella term that we use that describes common symptoms that occur when somebody has a neurodegenerative disease. So there's a disease happening in the brain that's causing damage, and this damage is resulting in changes in ability and function, and it is those changes that we refer to as dementia. So there's quite a few different neurodegenerative diseases that can cause this damage, and the most common by far is Alzheimer's disease. So if you wanted that overview of Alzheimer's disease, you can find it in our saved videos here on our Facebook page. So that Facebook Live was at the end of April. You'll find it there. Vascular dementia is another common occurrence. So this is when there is vascular damage happening in the brain causing damage, resulting in those symptoms of dementia. So my last Facebook Live broadcast at the beginning of the month talked about vascular dementia. So again, you'll find that in the saved videos here on our Facebook page. And today I'll talk about another fairly common type of dementia, which is Lewy body dementia. Before I do that though, and just to see whether, give people a chance to connect in, I do want to mention that it is May, and May is our Walk for Alzheimer's month. So the Alzheimer's Society of Simcoe County, we are a registered charity, and we do rely on the donations, the gratitude, the support of people in our county to fund the work that we do. So if you are interested in supporting our work, you could go to walkforalzheimers.ca and make a donation. Or if you would like to register as a walker and go out and walk 10,006 steps for the 10,006 people living with dementia here in Simcoe County, we would love to have you join us. You can ask friends and family all over the world to support you, and all that money goes to support the work here at the local society. So when you're looking for your community, I think the drop down, it's Barrie, but the money doesn't stay just in Barrie. It covers all of the county. Or if you're watching in from another community outside of Simcoe County, then find the community in where you live and support your own local Alzheimer's Society. So we do hope that you will join us in doing that. So again, I don't know if I've introduced myself yet, but my name is Erica Rice, and I'm an education coordinator at the Alzheimer's Society. So again, I'll be talking today about Lewy body dementia. And this is it's a complex disease, and so trying to explain it is a bit complex in itself, and that's why I've got some cue cards here with me today, so just to keep me on track and make sure I'm covering all the main points. So when you think about Lewy body dementia, when I talked about Alzheimer's disease, I mentioned that there is a misshapen protein that's building up in the brain. In that case, it's the beta amyloid protein, which is the hallmark of Alzheimer's disease. With Lewy body dementia, it's a different type of protein that is becoming misshapen and is building up inside of neurons, in this case, called the alpha-synuclein protein. And it's forming what we call Lewy body deposits within neurons, and it's causing these neurons to die off, disrupting connections between these neurons and others. Now, this is the same disease process that occurs in Parkinson's disease. So these two are related. It's kind of like its own little umbrella under Lewy body dementia. So with Parkinson's disease, we do have this misshapen alpha-synuclein protein occurring, but it's occurring in the region of the brain that's responsible for motor movement. So you'll see the motor changes with Parkinson's disease, but you won't see the cognitive changes, at least not in the beginning. Over time, however, as people live longer with Parkinson's disease, the risk that they will then develop the cognitive changes that we call dementia does increase. So they do say about 50 to 80% of people living with Parkinson's disease over time will develop dementia symptoms, because these changes move outside of the motor region of the brain into the cognitive regions of the brain. And so we start to see those changes. And this, if you have Parkinson's disease already well developed and then start to develop the cognitive changes, we call that Parkinson's disease dementia. Now, some people will have these Lewy body deposits happening in the cognitive regions of their brain before the motor symptoms occur. So if the cognitive changes happen first, this is what we call dementia with Lewy bodies, or sometimes diffuse Lewy body disease. So there's a few different names for that. Basically, it's the same disease process. It's just a matter of where are these Lewy bodies developing first, and in what degree are they developing? Are they causing enough damage to result in changes? So it's a bit of a tricky thing to figure out exactly what's going on. A lot of people with Lewy body dementia will get a diagnosis of Parkinson's disease, and they might have some of those Parkinsonian features, but then they're missing the cognitive aspect of the disease. So it can be a tricky thing for sure. Some common features then of Lewy body dementias, because we are talking, the Parkinsonian type features that are part of this disease, are issues with fine motor movement, which, it can be, especially with Lewy body dementia, more of an intention tremor. So like somebody is reaching out to grab something and their hand shakes before they are able to grab the item or press the button or so on. Fine motor movement issues in the face, and so being able to speak. Somebody might know what they want to say, but they're having trouble controlling their muscle movements in order to actually do the speech production to say what they want to say. So these kinds of changes can start occurring. We also see, that's part of this disease, fluctuating cognition and attention. So it's almost like an on-off switch. So if the switch is on, then the neural connections are being made, and maybe the person with this disease is able to see their environment correctly, understand reasoning, and so on. And then the switch turns off and connections aren't being made, and maybe they have moments of delusional thinking where they believe that somebody is trying to steal from them, and no amount of reasoning with them is going to change that. And then all of a sudden the switch flips again, and they know exactly what's happening in their environment. So it can be a difficult thing for care partners to try to support somebody with Lewy body, because it can seem like, well, you just understood it 10 minutes ago and now you don't. And why is this happening? So if you think of it as that on-off switch, and sometimes the switch is on and then it gets flipped off, it can help understand why there's such fluctuations in cognition. We also see the fluctuations in attention. So I know I had one gentleman in a class a few years ago who was very engaged in the conversation one moment, and then the next time I turned around, he looked like he had fallen asleep. And then 5 minutes later, he was back engaged in the conversation. So that fluctuating attention is one of the common features with this disease. And visual disturbances. So we often talk about the visual hallucinations that are part of Lewy body. I mean, you can have hallucinations in many different neurodegenerative diseases, but it's more prominent with Lewy body. And often these visual hallucinations are seeing people, children, animals, insects, things in your environment. So there's no trigger for these, it's not an illusion. It's not like I'm seeing something and I'm mistaking what it is. It's I'm seeing things that aren't actually there. So maybe the person is talking about the people in their living room, but there's nobody sitting in their living room. So this, of course, can also, for care partners, be very disturbing. Is why would you say there's people sitting in our living room when there's nobody here? But the brain is telling them that there's people there. And again, it's your brain that gives you your experience of your world. So if my brain is telling me there's people sitting here, then to me there's people sitting there. And it becomes that disconnect between what my brain is telling me if I'm living with Lewy body dementia and what your brain, if you're cognitively well, is telling you. So it can be, that disconnect of experience. But there's other visual hallucinations as well, or visual disturbances. Seeing like there's something in the vision field or over the vision field, paying more attention to the edges of items and surfaces and so on. So that's a common feature of this. When you think about the diagnostic criteria for Lewy body dementia, and they refer to the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, and this is where they lay out what's the diagnostic criteria for these different diseases. And when you look at Lewy body dementia, they talk about it has to have a gradual onset and a gradual progression. So it's not a quick change, like this is happening very like overnight or in a few days. So it's a gradual progression. And there's 3 core diagnostic features that are part of this. So one of them, as I mentioned, was the fluctuating cognition and attention. So they're looking for that. A second one is reoccurring, well-formed visual hallucinations. Again, like seeing people in my living room when there's nobody there. And the presence of spontaneous Parkinsonism that started after cognitive decline. So, as I mentioned before, Parkinson's disease dementia and dementia with Lewy bodies is kind of a timing thing. When do the symptoms happen and in what order? So with Lewy body, it's after the cognitive decline. All right, so, and it's spontaneous too, which means that it's not a result of medications being taken or so on. Then there's 2 suggestive features with Lewy body dementia. And one is REM sleep disorder. And what they're finding is actually people can have issues with REM sleep disorder for years before they actually show the cognitive changes that happen in Lewy body dementia. And REM sleep disorder, people might be having those waking dreams, acting out their dreams, sleepwalking. So a lot of those sleep disturbances. So that can be one of those warning signs that something is happening in the brain, but you don't see the cognitive changes occurring yet. And another big one here is marked sensitivity to certain types of medication. And this is important. This is why it's important to know get a correct diagnosis, know what is going on in the brain. When you think about things like somebody with Lewy body dementia might have delusional thinking or is having visual hallucinations, they can be misdiagnosed with another type of mental disorder, for example, maybe schizophrenia or bipolar. And you think about some of the medications that might be given to help manage those conditions, and in particular antipsychotics. For somebody with Lewy body dementia, this can have very adverse effects on them. So they don't react to medications the way that we would expect people to react. And so it's important to get a correct diagnosis and know what is occurring so that we know how to treat it and when to be careful about how we're treating the different symptoms that we're seeing. One thing we talk about Lewy body is that go low, go slow. So any medication should be at low doses and managed slowly over time, because we don't know how people are going to react to the medications. They just don't seem to have the typical response to them that we would want to see. All right, so I'd already talked a little bit about Parkinson's disease dementia, which is under that umbrella of dementia with Lewy bodies. Again, that's when somebody has Parkinson's disease that's been well developed, at least a year, and then starts to have those cognitive changes that we call dementia. And about 50 to 80% of people with Parkinson's disease will develop dementia over time, but it's not a guarantee. I mean, certainly people can have Parkinson's disease and not develop dementia. So getting that diagnosis, I mean, it can be tricky to figure out exactly what's going on. It can be a long and involved process. Of course, the first thing is to always communicate with your healthcare team just what it is that you are experiencing, if this is what you're experiencing yourself, or if you're a support person, what you're seeing in your family member or friend. Sharing things like those visual disturbances, really important. Sharing things like problems in sleeping patterns. They probably will be looking at doing a complete medical history on the person, family medical history. I mean, there's a lot that can be involved in getting an accurate diagnosis. So there's no definitive test that can say this is Lewy body dementia. So it can be tricky to do that for sure. So I just, I've kind of wrapped up my time. Certainly if you have any questions, kind of having trouble seeing my screen. I don't see any questions here on the screen, but feel free to message us on our Facebook page. I tried to get back to people as quickly as I can, so if you have any questions about Lewy body dementia, please send them there and I will do my best to respond to you very quickly. Next time on our Facebook Live, which will be on the Monday again, not next Monday, that's Victoria Day, but the following Monday, I'll be talking about overview of frontotemporal dementia, and that will wrap up our different types of dementia Facebook Live series. And just to end with our call to action again, because this is May, it's Walk for Alzheimer's Month, that if you would like to support the work of the Alzheimer's Society, to please go to walkforalzheimers.ca and find your local community in Simcoe County. It's Barrie, and make a donation or register as a walker and come join us and support the work that we do here in Simcoe County. So until next time, take care.